Welcome to Auditory Precision. My name is Aaron Shaw. I'm a hearing aid specialist, and I'm making some webinars and web videos to help individuals that want to pass the test to become specialists. Later on, we'll have some more advanced videos to help people pass the board. Most of the information will be coming from the new IHS book. It's their new distance learning book that came out in December of 2016. Some things have changed, so it is important to stay on top because some of the questions that will be on the test is coming from the new information. The other thing is a book that I've read called Digital Hearing Aids. This is good for any specialists that are already practicing. This is fantastic with explaining what digital microphones do, noise suppression, sound classes, compression, filters. It really explains how it's working, what we're doing, and basically how to use it to the best of your ability. What I am going to be talking about today is the vestibular system, which brings us into dizziness and balance. Now, the first thing I want to explain is that it's part of our red flag history, where we ask somebody if they have acute dizziness or chronic dizziness. And it's because it can be serious, especially if an ENT or doctor is not aware of it. It can be uncontrolled blood pressure medication, especially a fast-acting one like clonidine. It could be untreated angina pectoris, mitral valve prolapse. A lot of this has to do with not getting blood circulated like we should, and therefore we become dizzy and lightheaded. Another thing is if I'm asking these questions and they don't have a doctor, I get a little concerned. Sometimes I'll ask them if they have any chest discomfort or pain. Hopefully, and most of the time they say that they don't. But if they do, and they basically say that they can't pinpoint where that chest pain is coming from, and they use their fists, this is called the Levine Sign. And this isn't a sign that you really want to see a patient use to describe it, and that usually means you got to go to the ER. But what we do get to deal with here, because it is benign, if you will, is that we deal with vertigo and Meniere's disease. And so vertigo, which is called benign paroxysmal positional vertigo. Paroxysmal means that it's rapid, quick onset, and that's just dealing with the vestibular system. The vestibular system is a bit lateral and superior to the cochlea, and what happens here is that I have 3 semicircular canals. These allow me to do 3 things. I can shake my head no, I can say yes, and I can move my head side to side without falling over. The reason why is because I have a gelatin layer membrane that holds these otoliths, which are nothing more than calcified rocks. And basically what this is doing is it makes sure that when I am making a movement, I don't lose my balance and keep going. Eventually they get old, they fall off, and they disintegrate in the utricular saccule, and new ones are replaced. But if a healthy one falls off, a lot of times it'll stay floating around, and all I have to do is go down to tie my shoe or maybe look up at the ceiling, and all of a sudden it will get sucked into one of the semicircular canals. What ends up happening is that then I become extremely dizzy. I'll get nystagmus, which is shaking of the eyes, and this is something that can last for a couple of days. There is a maneuver that you can do. Physical therapists like to do it, doctors like to do it. It should be done with a professional, but it's called the Aptly Maneuver. And what happens is the patient will lay on the bed with their head off the bed at 30 degrees. They will look over at 45 degrees towards the ceiling to the side they feel more affected. A lot of times the eyes will start to shake. Even though it's not fun, it does show that this might work. After about a minute and a half, I'm going to slowly rotate over to look at 45 degrees up in the other corner. After a minute and a half, I'll turn on to my side and look down at the floor at 45 degrees, always leaving my head slightly off of the bed. At that point, I'll have somebody help sit me up, and sometimes instantly we can get it out of that area. Sometimes it needs to be done more than a couple of times, but again, it should be done with a professional. So that's what really we talk about when we're talking about vertigo. And when I'm talking about the vestibular system, I'm only talking about this area. If I'm talking about the Lybrinth system, I'm talking about the vestibular system and the cochlea. And what involves the 2 of those is Meniere's disease. So what we know here is that the cochlea has 3 canals, and my stapes will punch into the oval window, sending a wave into the scala vestibuli, or the higher canal. And that wave will go all the way to the apex, and come down at the scalotopani, or my bottom canal. And what happens is my riser membrane and my basilar membrane will move. And when this takes place, the organ of Corti will move with the tectoral plate, and basically it'll play the hairs like a violin, and this is where I will get the signal to actually hear noise. What will happen is the stria vascularis here, which is on the wall of our middle canal, will produce too much endolymph fluid. That swelling really won't allow my membranes to move, and therefore I will get some hearing loss. And that's going to affect this pink area, which you can see goes all the way through my vestibular system. So even though vertigo will cause dizziness, possibly nausea, and nystagmus, Meniere's disease can cause unilateral hearing loss, unilateral tinnitus, also on top of dizziness and nausea. A lot of times a diet can help this, as far as staying away from alcohol and low salt diet. But there's also a little area up here which is found kind of behind the semicircular canals called the endolymphatic sac. And what can happen here is we can actually put a shunt into this area, allowing excess endolymph fluid to drip out. That's really in extreme cases. But these are the two things that we mostly deal with when coming into dizziness. We have the vestibular system, the cochlea, and then with these two combined, we have the Lybrinth system. And if we find that this is all inflamed, you have labyrinthitis. Thank you.